G'day everyone, welcome back to the channel. So today we're going to talk about whiplash, and more specifically we're going to talk about sort of two exercises that you need to be doing, or two things you need to be thinking about if you have whiplash. And we're going to tie this into a concept that I don't think a lot of people are talking about in regards to whiplash and what causes whiplash. And I think that may sound strange because traditionally with whiplash, the cause of whiplash is relatively straightforward. You have maybe a car accident or something like that, and the force or the impact causes you neck pain and dysfunction, and then we're working to try and undo that dysfunction, help it heal so that you can recover as quickly as possible. However, clinically, there is potentially a step before all of this that we're missing, and I think it's a really important concept to pass on to people, because if you're working really hard on the traditional whiplash related exercises, you need to make sure you're adding these in amongst that to make sure that not only do you recover as quickly as you can, but that you don't have any problems in the future. And I think it's really important to discuss these things as well. So the first thing we'll talk about before we get to the two exercises is we want to talk about the concept of whiplash, what causes whiplash, and what we're potentially missing with whiplash as a whole. So I think most people will clearly recognize that for a lot of people with whiplash, you have no neck pain or dysfunction beforehand, you have an accident like a car accident, and then you get whiplash or some neck injury, some tissue damage from that accident, and then you have dysfunction that you need to settle. Now, I want to be very respectful to people who feel that way, because you absolutely didn't have any neck pain before the accident. You definitely have it afterwards, and it makes logical sense that they're connected, and they are. But the step beforehand that I think gets missed, the perspective that we don't necessarily see very well as a whole, is that from what I find clinically, the condition of your neck or the health of your neck or the function of your neck before the accident tends to be one of the main determining factors as to the type of dysfunction that you get from whiplash and how quickly you can recover from whiplash. And what I mean by that, because I know that can sound quite strange in a lot of ways, but I think the classic mechanism that causes whiplash for a lot of people isn't trauma. Now, there's absolutely a level of car accidents and accidents where you maybe have some trauma to your head or some trauma to your neck, and you get genuine neck pain and dysfunction from that. This isn't necessarily about those types of issues. It's more talking about the cases of whiplash that don't have neck or head trauma associated with them, where maybe you rear end someone, or you get hit from the side, or something happens where you have a sudden jolt of force. That force goes through your neck and creates dysfunction. And what I want to get across here is the state that your neck was in before that, even if there was no pain, is often the defining feature as to what gets injured and how bad it gets and how long it takes to get better. And what I mean by that is, we see for a lot of people who don't have neck pain, if you just assess people in general, you check out their range of motion, you check out their strength and their postural habits and things like that, most people are far from perfect. And if you were to feel through someone's neck, you're most likely going to find individual joint stiffness, muscles that are tight, muscles that are potentially weak and poorly positioned. Now, there's no guarantee that any of that will lead to pain just randomly in the future, because a lot of people can buffer that really well. So they essentially just, maybe it gets a bit worse, a bit better, they buffer it and they just keep going relatively pain-free forever. But what we find, if your threshold for pain is up here and you're going along quite happily, and then you have a huge jolt of force, it can basically challenge that threshold and tip you into the pain and injury side of things, where if your neck was perfect beforehand, it shouldn't necessarily register, or it may not necessarily register, or at least there's a stronger chance that it won't register. So the main point I want to get across in this first part of the video is that the health and function of your neck going into your accident and your whiplash injury defines a lot. And it's not to say that you would ever get neck pain and dysfunction, but it tells us that there's some underlying issues there already, that if we were to maybe scan your neck beyond the stiffness and tightness that some people may have, there may be some early onset of arthritis, maybe there's some wear and tear through the joints, maybe there's a disc that's bulging a little bit, maybe there's a little bit of stenosis or joint narrowing going on, maybe there's some dysfunction there that, again, isn't symptomatic, it's not painful, but if you put that less than perfect function and tissue quality into a challenging environment like an accident or a car accident, it may not stand up to that. And that's often what we see with whiplash. And it's important to make a really clear point of this because when you're trying to rehab your whiplash, we need to make sure that we're actually also addressing some of that root dysfunction to restore as much normality to the function of your neck whilst you're working all the standard things like neck strengthening, maybe getting a massage, you're working through your upper back strength work, your shoulder blades, all the things that are really well documented what you should be doing. Sometimes we're missing the bigger picture, which sort of leaves some gaps in a really thorough rehab program for whiplash. So having said that, so again, just to make it clear, even if you don't have pain before the accident, it doesn't mean that your neck was perfect beforehand. So we want to make sure that we're looking for those added bonuses, not bonuses, those added pieces of the puzzle to fill post-accident. So the two things we want to talk about are really basic. They're not that interesting in the grand scheme of things, but they're really important to really complete that puzzle. So the first thing that we want to talk about, the first exercise we want you to focus on is a neck mobility exercise. And we've done this a lot on the channel. It's such a good exercise. It has so many uses, but you can use a tennis ball or a lacrosse ball in this instance to go hunting for the stiffness and tightness in your neck and upper back. Remove a lot of that stiffness and tightness and fit a lot of slack back into your neck, allow all the tissue, all the dysfunctional tissue that's come along through whiplash. We can allow that tissue to function more normally, to be loaded up more normally, create a happier and safer environment for your body to do its thing. So again, if you're not aware, the way to do this is you can do this lying on the ground, but if you can place the ball, we just choose a spot, say in the middle of your neck, right on the spine. We then roll the ball off to the side and turn your neck a little bit to that side. We're going to go looking for stiffness and tightness. We're going to go looking for tissue that feels restricted. You want to get a sense of how well the ball sinks into this tissue. And then we want to compare it to the exact same spot on the other side. Now, if you have pain and tenderness on one side, and that's where your dysfunction is, but the other side feels a lot stiffer and tighter, you actually want to spend the most time on the side that feels stiffer and tighter because mechanically, we're looking to take away as many handbrakes as possible from that neck and upper back. And all we want you to do is find a spot, press into that spot, stay there for as long as it takes to free up. So that could be a couple of minutes, it could be half an hour if you want to. And we want you to sort of segmentally work your way up and down, looking for that stiffness and tightness and restoring as much normal motion to that tissue as possible. Again, still respecting your whiplash symptoms. You might need to use a tennis ball if it's quite tender in the area. You can go a little bit harder with a lacrosse ball if your pain's not too bad. But again, it's based on how you feel, so base it on how you feel. So once you've cleared a lot of that stiffness and tightness up, and we're restoring some of that sort of long-term stiffness and taking away some of that long-term stiffness, we then want to put it into a better position. So the second feature or the second exercise that's vital to anyone that has whiplash is making sure that you increase your awareness and your ability to put your neck in a better position. So what I mean by that is you may not necessarily think that posture matters for whiplash once you have it, but when we frame it in a bigger picture of whiplash potentially being an exposure of dysfunction that was already building up under the surface, it makes a lot more sense. So for example, if you are someone who uses a computer a lot or uses your phone a lot, or you're just in a position where you're often looking down or slouching depending on sort of what you do, let's just say you're looking down a lot, wherever the hinge is in your neck, so for a lot of people it's up higher if you're looking acutely down. So let's just say I look down a lot to do something, that tissue over time will become stiff and tight to cope with the demands that you've put on top of it. So wherever the hinge goes, so if I'm someone who bends through the base of my neck, then the weight of my head is going to increase the load at the base of my neck. And if I choose to be in this position a lot, even without realizing it, those tissues have to adapt. So they become stiffer and tighter. You take that into a car accident, they're less able to buffer that force, that accident. So if you're not then trying to bring yourself back up into a better position and keeping those shoulders back and cultivate better shapes, then if you are not aware of your posture, and say you start perfectly, but then you get on the computer, it's now an hour into it, and you've defaulted back into this position. So not only are you putting a handbrake on your body's ability to free up all this tissue with a ball, but if you have some dysfunctional tissue there from your whiplash, then you're going to consistently put it in a bad position as well, increase the load to that area, dysfunctionally load it, and potentially keep that hanging around for longer. So again, they may not sound like the most groundbreaking ideas, but they're crucial for anyone who's trying to conquer their whiplash in the short term and the long term. Even if you're someone who has any form of neck pain that hasn't come from trauma, or you're looking to avoid neck pain in general, if you're not looking for those hidden stiffnesses and tightnesses and valuing the positions that you put them in, then you can't be confident that you're going to be fine long term. And again, a lot of people are, so it's not a life or death situation in a lot of cases, but hindsight's generally perfectly clear. So just to summarize, a lot of whiplash, there's a strong percentage that come from trauma where you hit the area, it gets damaged and you have a problem. This isn't necessarily for those people, although you can never be, you can never function well enough. So you're welcome to do these things anyway. They're still going to help in some degree. But for everyone else who comes away with whiplash from a relatively non-traumatic experience, it's just the force that goes through your neck and exposes something. It's important to understand that you're exposing something that you most likely took into that car accident that just wasn't symptomatic to begin with. And if you can go after that asymptomatic stuff once you become symptomatic, then there's all these extra avenues to work on to improve the health and function of that. Because if you get your scan results back and you see that there's maybe a disc bulge there, or maybe one of your neck muscles has become damaged, or there's something going on, it can be very easy to become hyper-focused on the label that you've been given from the scan, when in actual fact, there's a whole bunch of other hidden dysfunction going on around it, that by improving that, you can improve how this feels, how it's loaded up, and how it progresses long-term. So hopefully that was useful information. Again, let me know in the comments below, how is your neck going? Have you had whiplash now for a long time? Did you find this video because you're just interested in the information, or are you dealing with something real and tangible that's just not getting better? Is this news to you? Let us know in the comments below. We'll make every effort to reply and have a discussion around that if you feel that's warranted. If you went on to enjoy the video, if you found it useful, please consider leaving a like below and subscribing if you are new. It just helps these videos get out to more people. Follow along if you're watching on Instagram. We just want to make sure that we get this information out so that everyone has a broader perspective and a more complete understanding of what they're going through. Because generally there's more to what you're going through, specifically with whiplash, but generally as well, than the diagnosis and the label you've been given. If your tissue's been damaged, there's generally other things around that make that more likely to happen. There has to be a reason why that specific part of your body is struggling. And if you haven't had that direct trauma to the area, generally it lies in your mechanics and how everything else around that is functioning. And that's just the piece of the puzzle that failed, as opposed to maybe having a bigger buffer so that tolerated that. So hopefully that was useful. Again, let us know how you're going with it all. And until the next time, we'll see you soon.